So next, we're actually very fortunate that our counselor, Dr. Ashraf Hatem, is also an expert in this pandemic that we're facing as a professor of pulmonary medicine. So Dr. Ashraf, if you don't mind, I'll ask you some things both in your capacity as our counselor and then also as a medical doctor. So first, if you would comment about how AUC is coordinating with the authorities and your expectations of what will be happening next with this pandemic that we're all facing.
Yes, thank you, Vina. During the last 3 years, my main role as a counselor was to be an interface or a liaison between the AUC and the Egyptian authorities and the Egyptian community as a whole. And mainly it was the Supreme Council of Universities, the academics, and the Ministry of Higher Education. During this last few weeks, since the COVID-19 pandemic came over, nowadays the main minute-to-minute interface is with the Ministry of Higher Education again, but also the Ministry of Health and the EMRO, which is the WHO East Mediterranean region. And in my other hat, as you said, as a professor of pulmonology and as part of the task force for the pandemic of the H1N1 in 2009, I'm now one of the members of the advisory scientific committee of the government for combating the COVID-19 pandemic. I assure you that everything which is there, either from the scientific part or from the governmental part and the authorities part, is minute by minute conveyed to the AUC. The main concern is the health and safety of our community.
Thank you, Dr. Ashraf. Thank you, VP Sheikh. So I'd like to address some of the questions we're getting online, and as needed, we may also call on some of the members of the task force not with us in the room. First, I think I'd like to go to Councillor Ashraf Hatem. There have been a number of questions around the medical sort of responses and what people should do. We received a couple of questions of people who feel nervous that they may have symptoms or are concerned about having been in contact. So what is your advice for someone who's concerned that they might have it or have come into contact who may have the virus?
Okay, something which is very, very important that even if somebody has the disease or got infected with the COVID-19, 85 to 90% of the cases are mild cases and they resolve by itself. So something which is very important that if I am a contact, I'm coming from a country which is we have up to now 4, now became 5 countries which are hot countries, which is China, South Korea, Iran, Italy, and added Spain to them. If I'm coming from them, just stay at home if I don't have symptoms. If I have slight flu-like symptoms or mild flu-like symptoms, which are some sore throat, some coughing, low-grade fever or fever, I should contact my physician and the hotline of the AUC, and again stay at home, because it is a simple disease which will resolve completely if I don't have any risk factor.
Thank you. The next question I'd like to address to Dr. Ashraf. This is specifically about Egypt's kind of preparation for the pandemic. So one of the questions is, do you feel that Egypt is prepared? And I'll bundle that with another question specifically about a scenario if a faculty or student were to become ill. Is the university prepared to support them, whether in finding a hospital bed, or what would happen in the event that a member of our community was ill, and whether the university is prepared to provide what type of assistance?
Yes, let me answer the second question first. Yes, of course. As you all know, we have a flow chart to manage if somebody is ill. Either the illness is a flu-like symptoms or even a positive case, and how to manage this. How to the university have for faculty, staff, and students have a good insurance companies, and there is a contract with some hospitals if it is just flu-like symptoms or symptoms which is a suspected case. If it is not highly suspected, if it's highly suspected, the hospital, which is the Air Force Hospital, transfer the suspected case to the fever hospital according to the protocol of the Ministry of Health up to now. It may at some time open also in some university hospitals like Ain Shams Specialized Hospital or others in few days to come. But up to now, the suspected cases, if there is severe symptoms, they are transferred to a fever hospital. In this fever hospital, the test for the corona is done, and the patient, if it is positive, he will take the treatment for free, and then when he turns negative, he returns back home safely. And again, most of the cases which have been discovered in Egypt, which is about now 200 cases, 200 plus cases, 85% of them, or even 95% of them, were simple cases. They don't have, only a few cases have this severe respiratory distress, and they are mechanically ventilated. They are those who have these very severe symptoms, who are in very old and in patients who have low immunity. Is the country prepared? Of course, this is a pandemic, and even the countries in the whole world, they have the healthcare system is challenged by this number of cases. The Ministry of Health, and not only the Ministry of Health, Ministry of Health and all other supportive ministries, and there is a higher committee headed by the Prime Minister. They are every day they have a meeting, and they are every ministry are supporting the Ministry of Health with the cooperation with the WHO and the other international scientific groups, and they are doing what is needed from them. Is this enough or not? It is actually up to now, Egypt is, according to the WHO, is a low country which has a low incidence of positive cases.
Thank you, Dr. Ashraf. I'm going to shift back to Dr. Ashraf. We have a question specifically about precautions people can take, so personal precautions. We've all heard about the importance of hand washing, but this is talking about, addresses about toddlers and any advice on young children, what to do about that, and in particular diet. Is there any? The question is, is there any truth in the advice regarding what people should eat or not eat in this time?
The good news that COVID-19 does not affect children, or very, very rarely affect children below the age of 5 or even 8 years, and from 8 to 15, also the percentage of infection is also very low. So toddlers definitely, maybe in the 200,000 cases which are positive, maybe there has only one case reported in China. But It is said that children, young children, if they go outside, they go to the nurseries or to the schools, they can be carriers of this of the virus, and they can give it to their especially grandmothers and grandfathers. So, and that's why this is the cause of closure of the nurseries and the schools, and not because they are affected. As for what to eat, and it is balanced diet. There's nothing except balanced diet. The only thing which may help in increasing the flu as a whole is to take vitamin C. Maybe it is something which is good for mainly the mucous membranes, and it is the recommended is 1,000 milligrams of vitamin C per day. This is the only thing which also don't have a solid proof, but it is good for the health as a whole.
And one additional follow-up question on that is, what about colleagues on campus who may suffer from reduced immunity, whether they're staff or faculty or students? Is there a particular guidance for them?
And that's why, according to the government and to the regulations here in the HR and the university, they are eligible for a sick leave during this period of the pandemic, because anybody who has a reduced immunity, which are any chronic respiratory disease, any chronic cardiac disease, renal disease, if they are diabetics who are not controlled, or are taking immunosuppressants, corticosteroids, or chemotherapy, these are the high-risk patients. But again, pregnancy is not a high risk for those who are pregnant.
I think that we sort of tackled this, Dr. Ashraf, but maybe we can be a little bit more specific about it, because it continues to come up. A question is specifically about testing. So people are concerned, how can they get testing? Where can they get testing? Can our clinic test them? So if you can address sort of the testing question.
Yes. Again, testing for the virus, there are several types of testing. The one which is present in Egypt, which is a confirmatory test, is the PCR. The PCR testing is, according to the government regulatory authority, is only present in the central lab of the Ministry of Health, and in other reference labs in universities like the Ain Shams Specialized Hospital. But again, according to all the guidelines in everywhere in the world, testing is not done except for severe cases. And testing is not anybody who has some flu-like symptoms can go to a lab and do testing. This is not advised, and it doesn't do anything to do this test. We have a contract with Ain Shams Specialized Hospital. If somebody is coming from a hot place and he has symptoms and he is isolated in his home and starts to have symptoms, the clinic can get, we can send somebody from the Ain Shams Specialized Hospital for him to get the sample. It is a nasopharyngeal sample, and we get it positive or negative after that. But if he is positive, this is a very important thing. If he is positive, he will go to a quarantine hospital, which is outside the Cairo area. There is one in Ismailia and one in Marsa Matruh. So if he has mild symptoms, it's better not to be tested, because it is self-contained, and there is there's nothing to be done for him, because he will also take an antipyretics If he has some sputum, he'll take an antibiotic also with it. So, and the antiviral which is present in the pharmacies, which is the Tamiflu, which is the antiviral for the H1N1, is also used for these mild cases. So the test is available. Another test will be available 1 week from now. It is the antibody testing. It is an ELISA testing, and it is a rapid test. It will be available in the private labs, but it does not. If it is positive, we need to do a confirmatory test in the central lab. But again, it is not advised to do this test.
Thank you, Dr. Ashraf.